Lung cancer is by far the leading cause of cancer deaths among men and women, claiming more lives than breast, colon, and prostate cancers combined. And get this, 65% of lung cancer patients either have never smoked or quit years ago. Dr. Christine Lovely and lung cancer patient Linnea Olson joined me to discuss the latest breakthrough in treating the disease. Thank you both so much for joining me.
Hi, good morning, and thank you for having us.
Thank you.
Of course. So Linnea, we'll get to your story here in just a little bit. But doctor, starting with you, there's new hope actually for people who've been diagnosed, right?
Yeah, there's tremendous new hope. And thank you so much for that really wonderful introduction to this major public health problem. Just to put a number behind this, there's 235,000 new cases of lung cancer in the United States every year. That's a staggering number. This has been a major problem that we've been battling, and I think there is, like you said, a lot of hope in this area, all the way from the way we can actually diagnose the lung cancer earlier in patients who are at risk, new ways to treat lung cancer with new agents like immunotherapy or targeted therapies, and new ways to monitor the cancer in something called a liquid biopsy, where we can actually potentially find pieces of the cancer in the blood.
Well, to get diagnosed or to rule it out, you have to first get screened. So who should get screened for lung cancer?
Correct. And so screening has been a significant advance, and there's other cancers that we screen for, like breast cancer and colon cancer. We haven't had a lung cancer screen until recently. Right now, the guidelines suggest that if you are age 55 to 80 and are either a current smoker or have quit smoking in the past 15 years, that you would be eligible for lung cancer screening. That screening would involve a CT scan, which can be done in most physicians' offices. And I encourage patients out there to think about talking to their doctor about lung cancer screening. But I also want to say that there is a significant number of lung cancer patients who would not be eligible for screening, such as Linnea. So we're not going to capture every patient with screening. Screening is very important, but there's still opportunity for lung cancer to be diagnosed even in the absence of screening.
And Linnea, like I said, you live with this disease. Can you give us just an idea of your story?
Sure. I was diagnosed in 2005 at the age of 45. I had never smoked, so it was a complete surprise. I had most of my left lung removed, followed by chemotherapy, which were the only treatment options open to me at that time. My cancer progressed anyway, and by the summer of 2008, I was advised that I had 3 to 5 months left to live. So I began to say goodbye to family. My youngest son started counseling, and then we discovered that I had this ALK mutation, which had just been identified. And I had an opportunity to enroll in a phase 1 clinical trial that targeted ALK, and I had an amazing response. And now, more than 10 years later, I'm in my 3rd phase 1 clinical trial.
Wow, well, I am so happy to be able to stand here and talk to you today. I'm so glad that things worked out the way they did. Of course, you're still dealing with it, but it's being treated, of course. What would you tell people watching right now to warn them about sort of not paying attention and thinking that they can't be affected?
Well, I think you have to be your own best advocate, because in my case, I was symptomatic, and you don't always hear people say that, but I had shortness of breath, I had cough, I had fatigue. At one point, I even had a doctor suggest that I might be a hypochondriac. So it was hard to keep pushing, but I did, and ultimately, I was diagnosed.
Well, thank you again so much for sharing your very personal story. And doctor, before I let you both go, where can we get more resources and information?
Absolutely. I would encourage all your viewers to look at the website lcfamerica.org. That's a website run by the Lung Cancer Foundation of America. It's an advocacy group that supports lung cancer research, and the website has accurate, up-to-date information for lung cancer patients and their families. Again, lcfamerica.org.
A very important and sobering reminder for everybody. Thank you both so much.
Thank you.
Stay where you are. We'll be right back.